Welcome back to the Morning Blend. It's true, I just recovered from a sinus infection. Plenty of people around the office are suffering too. Two of us at the same time had a sinus infection. It was horrible. Not Tiff. Welcome back. Sinus infections can be a real pain.
Yes, I was surprised that 31 million Americans are afflicted with chronic sinus infections every year. My mother is also one of them. Dr. Madan Kandula is back from Advent, and he is the first surgeon in Wisconsin to use a new treatment for chronic sinus problems. Welcome back. This is going to be like news to many people's ears. It's going to ring for them.
Yeah, I hope so. It's pretty cool.
And I thought you brought a hairnet because you set something down on the table. I'm like, what, you're going to wear a hairnet today? You don't need one.
No, I don't need one. I keep it closely cropped. So,
but what is it? It's this new treatment that does what?
Yeah, so this is a new sinus treatment. It's actually what we're able to do is implant a device into the sinuses that basically leaks out a steroid medicine. So it gets right to the source of where somebody's having trouble. This is not for somebody who's got a everyday run-of-the-mill infection. This is for folks who are having either repetitive infections or for folks who are having just chronic infections that never go away. And so what we're able to do is get the sinus passages open, place this implant in there, and this gradually dissolves away. And as it's dissolving away, it's leaking out a medicine to help to heal the sinuses.
So it's not permanent?
No.
Okay, so it's called the Propel, and I think it's pretty rare that we've heard on this show that a physician is asked to use a treatment for the first time or kind of new, but you're somebody who they've kind of designated as someone to try out and use this new treatment.
Yeah, it's pretty cool. I mean, it's sort of, this is one of a few different things that I've done here in the past and brought to Wisconsin. And it's been pretty cool. I mean, this is unrelated. It's a company that's unrelated to some of the other companies I've worked with. And, you know, we're really actually, in the grand scheme of things, kind of small potatoes. I mean, it's just, you know, Gwen and I as far as the practice goes. And it's pretty cool that folks sort of around the country seek us out to you know, basically evaluate their product.
Right, because usually you think of that as an academic institution, medical institution that they're going to contact rather than someone like you who's in a private practice. And I always think of you as having a somewhat conservative approach. I don't know if you see it that way too, but you'll kind of exhaust a lot of things before you'll move towards surgery. Because people always say if you see a surgeon, you're going to get surgery. I don't think that's necessarily true with you.
No, it's not. I mean, I guess it depends on somebody's issues. I'm not going to give somebody the runaround, I guess, is the bottom line. So if I think that a treatment is going to help them, I'm going to offer that treatment to them. This comes back to why I like to try some new things out. I'm actually pretty set in my ways. I mean, I like to do what I like to do the way I like to do it. And if something new comes along, you know, it's got to offer something unique, different, and a benefit to the patients for me to go and change what I'm doing. Because actually, I'm very happy with sort of the success that we get from the treatments that we offer. And, you know, again, I don't want to do anything that's going to go against that. And this doesn't. This is definitely an additive benefit for my patients.
Yeah, and you're always kind of on that cutting edge, and I think that's something great for people to know that whenever they come to you, they're going to get something that's going to last and is going to be right for them.
Right.
You know, when we talked about that statistic earlier, the 31 million Americans, I think that's a huge number. So just kind of explain to me, somebody who doesn't get infections, what the sinuses are and what happens when they become infected.
So the sinuses, they're air-filled cavities around the nose, and they all have little openings into the nose itself. And for folks who have either repetitive infections or chronic infections, almost always the issue is that those openings are not functioning for them. And so it's a plumbing issue. And so at the end of the day, if somebody's having lots of trouble, what we end up needing to do is get in there, get those passageways open. Nowadays, there's a variety of techniques we can use, and so that helps a large majority of folks. And Propel, which is the sort of new implant we're talking about, is something we use in combination with some of those other techniques. We get those sinus openings open. Once they're open, we place the implant into the sinuses, and that is what delivers the medicine to those tissues.
Do you see this as being kind of a game changer? Can you describe how it works to us and why it might be indicated?
Yeah, I guess I'll do my little reveal.
Yeah,
I don't know what's the
hold
best
that real
spot.
still till we get a shot of it.
Because it's really hard to see. It's very almost like see-through.
Yep.
It feels so.
So what that is made out of, it's just made out of a suture material, and the material's been around for a long time. That goes in. It's got a springy effect, so you know you can pinch it down, but it's going to push back out at you. And we deliver it with a device that puts it up into the sinus cavities, and it's sitting there, and it's gradually it's embedded with that steroid medicine, and the same medicine that's in Nasonex. A lot of folks have heard of that medicine. Same medicine that's impregnated in there, and that's gradually dissolving away in the sinuses, up in the lining of those cavities. So instead of spraying a spray in your nose, which is great for where it can get to, this gets to where I want it to be and gets gets it up into those cavities. And again, it's not a permanent thing, but it really helps the healing process, helps to allow things to heal up the way I want them to heal up, and really speeds folks forward as far as the recovery process goes.
Well, yeah, you can tell it's just way more precise too.
Yep.
So who's the right candidate for this?
Well, really, for folks who have those chronic issues, so chronic infection, those sorts of folks, actually the picture perfect candidate for this is somebody who has polyps. Polyps are fleshy bits of tissue that form on the inside of the nose, and lots of folks who have really everybody who has polyps has issues with chronic infections, and the best treatment for those folks is to get in there and surgically open up those passageways, get rid of the polyps. If we can have something on the other side of the fence that's sitting there putting medicine up in those cavities, a steroid medicine helps to soothe the lining, that's ideal. This is ideal for those folks.
Because steroids kind of tend to shrink those linings in those tissues,
exactly.
right?
So what steroids do is basically it pulls down swelling. It doesn't care why the swelling is there, it just pulls it down. And so steroids sometimes get a bad rap because of the pills. You take the pills, they get through your whole body, and they create some after effects and side effects. If we can get them on the tissues that we want them to be on and just to that spot, that's perfect. So it's really very targeted, and this is as targeted as you get.
That's wonderful. Real quick, covered by insurance?
Yep, absolutely.
That's wonderful. Here's where you can contact Advent to make sure that you don't suffer from sinus infections anymore. The Sinus Center is located on North Mayfair Road in Wauwatosa. It's 414-771-6780, or visit advent.md for more information. Find out if you're a good candidate for this brand new procedure. Thanks so much for being here, Doctor.
Thank you.
Thank you.
Thank you very much.
Appreciate it.
Still ahead in the show, some advice about